Namaste. The sixth edition of the Health of the Nation report is distinctive. It is built on the data from across the Apollo health system. It is not just surveys, it is not estimates, not projections. Drawing from real clinical data through Apollo Hospital's health checks and through our unique lens, the report travels far, wide, and deep at the same time. Corporate India is indeed powering our economy, but at what cost to its health is an interesting question that has come up after the Health of the Nation Report 2026. Over 5 lakh corporate health assessments have been done, and the data reveals a workforce which is at metabolic crossroads. Nearly half of corporate India has dysglycemia, either diabetes or prediabetes. 8 in 10 are overweight or obese, and quite a few of them, almost over 60%, are physically inactive, and about 55% have abnormal lipids as well. So, this is not just a coincidence, I'm sure. It is the corporate lifestyle effect. So, to discuss this and to guide us further on this finding, I am delighted to welcome Dr. Ravi Sankar from Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Ravi Sankar is a senior consultant endocrinologist and diabetologist with over 20 years of experience delivering comprehensive care for a wide range of hormonal and metabolic disorders. He is committed to providing advanced, patient centric treatment in a comfortable and holistic environment for every individual that he cares for. Welcome, Doctor, and thank you so much for joining us. So, let me begin by asking you about long hours, high stress, deadlines. Are you seeing a pattern of similar health issues which come from this pattern that you see in corporate professional life?
I think there has been a lot of discussion over the last few years, sparkled by Sri Narayanamurthy Garu and the L&T then chairman as to how long we need to work. And there has been a lot of discussion in the social media and, of course, in other media platforms as well. That apart, we all have our own targets, right? From a clinician sitting in the clinic, in terms of the target, as in the total number of patients that he needs to see by the end of the day. For instance, say if there are 10 patients waiting outside, I did have a target that I need to see all of them before I start this webinar because I didn't want them to wait. So targets differ in different forms and shapes for each individual. So for me, that without knowing does put a bit of pressure. And if you see an IT person, the person has a different target. He's supposed to deliver the product by such as deadline, and that puts enormous target on the individual. So targets do differ, hours do differ, and of course, long hours are a burden for everyone, and they take away the time from everyone's personal life, and of course, everyone's free time as well. So I think these do have an impact on general bearing. They do have an impact on the general health of an individual in different forms and shapes. As to how they do, let me give some examples. I think examples connect more than theory.
Absolutely.
For instance, I tell a patient, look, you need to go to bed by 10 o'clock because sleep deprivation and poor sleep quality and the timing of sleep really matter a lot. The person answers quickly saying, Doctor, I work long hours and my time really finishes only at 12 o'clock at midnight. There itself, I think we lost the battle. So at the end of the day, our occupation does play a significant role and it has an impact on how we perform in terms of our health. So this is something we all need to acknowledge. And this applies more so to the corporate world because these are, I would say, white collar jobs wherein we all work in a very sophisticated manner. And we really try to honor our targets and deadlines, be it me trying to see all my patients before I commence this webinar, or an IT guy trying to deliver the product by so and so deadline. So at the end of the day, this not only depletes invaluable sleep time, invaluable hours that one could have otherwise dedicated to the family or exercise, or for that matter, even any free time. Doing nothing in itself can be actually relaxing in times. And if we extrapolate from this, if somebody were to work long hours, we're not just speaking about the hours per se, but we are also speaking about the emotional, physical stress that the person goes through. If a person were to be sitting prolonged periods of time in front of the desktop, if we really look at it, that puts a lot of strain on the lower back. We all know that. Not to forget the C spine as well. C spine means the neck area, just for the common man over there who's listening. So these are common things that we tend to ignore and forget. And just expanding this, studies have recently shown that sitting is the new smoking. If at all a person were to sit for prolonged periods of time, that's as bad as somebody who smokes few cigarettes a day. Even if the person does not smoke, the sitting sedentary lifestyle that the person leads, which unfortunately many of the corporate workers, including me, can lead if at all we were to sit for prolonged periods of time, can lead to a lot of health complications, including heart disease and type 2 diabetes. So I think overall, if I have to sum it, yes, long hours, target driven culture, and lack of free time do all culminate in not so good outcomes when it comes to health outcomes.
Flights, late nights, food on the go. So, how much damage is this doing?
Again, let's start with flights. Yeah. Each time a person were to travel from one place to another, it's not just the journey and the miles that the person is clocking, but the impact of all these that they have on the person's lifestyle and health in general. You have to catch a flight at 7 o'clock in the morning. You're going to wake up at 4 o'clock in the morning, try to go to the airport by 5:30, half five, and catch the flight, which means you're deprived of the essential sleep that you would have otherwise got. So your sleep has gone for a toss. On top of it, you would not be having your breakfast, the usual breakfast that you have at your home in the morning. I'm just trying to extrapolate this to health outcomes because clearly sleep deprivation has been shown over the years that it can lead to serious adverse health outcomes in terms of type 2 diabetes risk, in terms of cardiovascular risk, in terms of hypertension, in terms of mental and emotional stress, which can lead to serious consequences. So, what might otherwise sound as just waking up at morning 4 o'clock to catch a flight, which most of the corporate workers really do face at some point in their career, can lead to serious adverse health outcomes. It's not yet over. The person has caught up with his sleep, assuming that the person slept in the flight. Is it going to be exactly the same as the otherwise ordinary sleep? Definitely not. And the food that the person has at airport, we all know that home food is home food. The food that is served anywhere, even in the best of restaurants, even in the best of five-star hotels, would not be the same as the food that we eat at our own home. We know what goes into it. We know what our gut can take and what it can't take. So the person has somehow reached the destination, hoping that there is no delay in the flight. And then the person has a busy meeting. And again, the person grabs whatever he or she can grab there in terms of a sandwich or in terms of a corporate lunch or whatever. And assuming that the person is a diabetic, imagine what the person eats there. Whatever is served there, he or she has to grab, and the person can't be picky and choosy about the nuances in the diet. So perhaps the blood sugar levels would go for a toss. If the food were to be delayed, the person might incur a hypoglycemic event. That means a low blood glucose read. So assuming the meetings, everything have concluded nicely, and the person hits the sack by 10 o'clock in a hotel room in the new destination place. And let's imagine a scenario that the person is used to sleeping at 10 o'clock and the person still managed to go to bed at 10 o'clock. he or she might not get the necessary sleep there because of the new environment. We all know that our bed is our bed, and we are used to sleeping comfortably in our own bed. Even if it's a five-star hotel, it's not going to be the same in terms of the room's ambience, temperature, and the comfort, etc., etc. So the sleep has gone southwards. The workout pattern has gone for a toss because the person didn't exercise that day, as the person has woken up early in the morning and had to catch the flight. Third, the person either had a high blood glucose reading if the person were to be diabetic, or had a low blood glucose. And last but not the least, sleep deprived again because the person couldn't sleep at night. So this is how typically most of the people experience when they travel. And all this is assuming that the travel is within India. If they were to fly out of India, different time zones, I think that's a different ball game altogether. Then comes the jet lag. Then comes again, completely different cuisine. Even if they are experienced and adapted to different cuisine, still I think that would have a bearing on the gut health and so on and so forth. So this is just an example of how things can go wrong with a simple travel, or what is construed as a simple travel otherwise. And add to this the stress that goes with it, subconsciously, unconsciously. See, when you know that you got to catch a flight next day morning, the sleep that you get is not quite the same as a regular routine day. We all know that. We all have experienced it.
Yes.
And surprisingly or otherwise, studies have clearly shown that you wake up to an alarm clock, that your blood pressure shoots up significantly, and that can lead to cardiac events. These are simple studies, but they did suggest, at least, if not confirm, that the blood pressure can shoot up significantly when an alarm clock goes up to wake you up in the morning. So otherwise, the person wouldn't have had that increase in the blood pressure, because the person would have woken up at the regular time, which is 6 o'clock or 7 o'clock in the morning, and the person had to wake up. So everything matters when it comes to travel. Travel is a big killer. If you're going on a holiday, that's a different thing. But if you're going on a target driven, corporate lifestyle driven, in a corporate driven way, I think it has a lot of consequences on both physical, emotional, and uh, all forms of health.
Also, what people think fuels productivity. So many times we all have this to keep us going kind of thing. So there's coffee, there's energy drinks, or sugary stuff, sugary tea. So what are we doing in this? Are we really fueling productivity, or do you think this is very harmful?
Good question, ma'am. I think when people resort to eating or drinking anything in between their work, I think it's mostly psychology driven, because we want to keep ourselves awake, we want to keep ourselves focused. We develop this concept thinking that if we drink coffee, I think we'll be energetic and we can really focus on what we want to do, or it can keep us going without falling asleep, even if we are tired. I think that would have a lot of health consequences. I'll give you some examples. Say somebody were to have a lot of coffee. We know that caffeine causes palpitations to begin with. It can cause sleep deprivation if you were to have coffee late in the evenings. These are simple stuff. If you were to drink these what they call as energy drinks in lieu of coffee, that has other consequences. Those are really calorie dense, and that can lead to weight gain without one realizing that they're actually putting on weight or piling on weight on a daily basis. So that is something very, very important, because one got to be cautious, unconscious when they were to really binge on these drinks. And the concept of being cool and going out of your seat along with colleagues to the cafeteria to drink these beverages can actually lead to a lot of weight gain, I would say, in majority of people, and this becomes a habit. For instance, I'll give my own example. There are a bunch of doctors here. We go to the cafeteria around 10:30 to just grab a quick coffee or whatever there. And when I notice what people grab, without their attention, they eat a lot of snacks, and most of them are unhealthy. And this culture is there in most corporate worlds, be it doctors, be it IT guys, finance industry, whatever. So I think one needs to shy away from going unnecessarily. They can take a stroll. Instead, going on a simple stroll into the garden, I think that would be more productive in terms of health. That would be more productive in terms of work outcomes as well, because that would make you focus, make you feel more relaxed rather than having a lot of shots of coffee. This is just a practical tip that I'm suggesting. Moreover, that makes you feel relaxed in terms of your back, neck, and you also feel that you're back to your work in a comfortable way rather than again drinking a lot of unnecessary stuff.
So, doctor, now you gave one practical tip now for avoiding. So, if you want a break, you just take a stroll and it's better for you. Now, a lot of the things that we discussed all this while is somewhat non-negotiable because people do what they do work and they cannot control sometimes the travel or the late nights or their shifts. So, what do we do? Because I know that people are kind of caught between, like, the devil and the deep sea. So there's on one hand a system that rewards presence, output, and this is really rewarded that you worked on weekends, you're like all the time doing stuff, you're not taking a break. But at the same time, this is also impacting health. So I think I want to just conclude this chat by asking what would your practical suggestions be? Because we find a lot of people are in this situation and they can only do what they can do. So, what can they do?
Yeah, there's a lot that one can do within the limitations that we do. For instance, having a structure to our day really helps. So let me put it this way: irrespective of wherever you are, the least that one can do in terms of exercise is go for a walk, jog, if a gym or such facilities are not available. Say somebody has traveled away from their workplace. I don't think there is a place that would forbid the person from going on a jog or going to the local gym, or if they're in a hotel, to the gym within the hotel, or at least go for a stroll in the on the road early in the morning. Okay, usually most places do have this kind of facility. So, irrespective of where one is, dedicating that half an hour to 45 minutes for some kind of physical activity, that helps. So, physical activity is taken care of. Coming to diet, I think one needs to understand as to what is on the plate. If you understand the nutrients, both macro and micro, when I speak about macro, I'm speaking about the carbohydrates, the protein, the fat, the types of fat and the types of protein and the types of carbohydrate, simple carbohydrate, complex carbohydrate, glycemic index of these. So you are conscious and you understand what is going into the plate and onto the palate. So that's very important. So if we understand the quantity of food and the quality of food that we are eating, consciously or unconsciously, that really helps. So, irrespective of whether you're here in Spain or in America, I think you would really be conscious and you would follow a schedule to your food. Just because coffee is offered, you won't gulp it. Just because cookies are offered, you won't eat them. Just because they're offered. Coming to the third aspect, which is very important, sleep. I think we all need to understand that we need to wind up our days by a certain period of time, however busy we are. And staying late up in the night does not necessarily add value to the work that we do. In fact, it can be counterproductive because you can make more errors and the output may not be as good as what you do in the morning times. I mean, this is again ancient Indian wisdom as well to a certain extent. And this is nothing but the circadian rhythm as to how the biological clock in the body is made. Certain hormones do calm down during nighttime. They're supposed to, such as corticosteroids, and certain hormones, such as growth hormone, are supposed to be released. And if we extrapolate all that into our daily schedule, have a structure to our madness. That's what I'm saying. We can't run away from the work and the life that we're living in. But if we incorporate a kind of structure to it, I think
Yes.
it really does help. For instance, people go and drink coffee. Instead, they might actually eat a healthy fruit at the same time. There's nothing that is forbidding the person from eating a fruit. So instead of multiple coffee day visits, one might instead have a fruit or two, and that would be a lot more healthy. That's also filling. So I think one needs to understand the basics about health, go back to the fundamentals, be it diet, sleep, exercise, and adhere to that such a pattern that one has devised himself or for herself. And that would go a long way rather than uh, finding excuses for ourselves that we can't do the good things because of the work stress that we
So
are.
we build those into our existing routine,
Yeah,
is what I
absolutely.
think I'd like to
Absolutely.
say. So thank you so much, Doctor. I think this has been a very, very useful guidance for our corporate viewers and for anybody who's working really. And viewers, I would like to say that the Health of the Nation report has much more of these kind of valuable insights, and these are deep insights into key health parameters, and they are data from people like you. So reading it will give you a deep insight into your health and also understand how our lifestyle is impacting our health, both for good and bad. So do download the report and go through it. The link is in the bio. And for those of you on YouTube, the link is in the description. Doctor, thank you so much for joining us. And viewers, thank you for joining. Take care. Namaste.
Namaste.